Hi, I'm Dr. Vonda Wright. I'm an orthopedic sports surgeon, and I have been practicing nearly 25 years. You know, I grew up on a farm in Kansas, and so even growing up, I had this deep understanding of what it meant to see something in your brain and build it with your hands. And as I was considering what profession to choose, I knew I had to be a surgeon. But what kind of surgeon? Well, there are lots of options, but there is only one option that allows you to treat people from the minute of their birth to the minute of their death and use the tools of mobility to help people stay healthy. And that's orthopedic surgery. And I'm an orthopedic sports surgeon. So what could be more fun, more fulfilling than taking care of people who are striving to live their best lives, to get back out on the road, to get back in their backyards, or even just to go back to work. I love what I do, but maybe it stems from growing up on a farm. You know, the only reason I show up every day to come to work is because of the people that I get to take care of. Yes, I love doing surgery. I really do. And I feel like I'm really good at it. But the reason to come to work is my knowledge that by helping people in times when they are most vulnerable, when they're in pain, to get their mobility back and to be out of pain, that is so satisfying. And that's why I come to work every day, because here's what my motto has been for the entirety of my career. By saving your mobility, I will be saving you from the ravages of chronic disease, and we'll do it together. You know, it's hard for me to pinpoint when asked, what is your favorite case? What is the person you remember the most in your practice? Well, I've been practicing a long time, and I've had the privilege of taking care of a lot of amazing people. And so I remember a kid at the University of Pittsburgh when I was the head football doctor whose life was football. That was it for him. He lived it, ate it, drank it, would die for it. And you know what? In a tragic accident on the field at Heinz Field, he dislocated his knee. And that is an injury that many people do not return from. So we took care of him for nearly 2 years. I personally performed 3 surgeries on him because of his heart, because of his desire to be back on the field. Do you know he made it in 2 years? And it's enough thanks that he remembered to send me the signed picture on the wall, but it's even more thanks that after football, he went on to live an amazing life where he currently coaches. And you know, on the way in to talk about what I love about surgery today, I saw another kid here from Lake Nona who had nearly the same injury. And we have been working with him for an entire year now. And it is not a hope or a dream, but he is going to return to the sport that he loves. He just told me how amazing he's feeling, and that's why I show up every day. But it's not just for athletes, it's for everyday people like you and me who just want to live better. I had a patient earlier this year who broke her hip. She was very young and broke her hip. So doing the surgery that puts the bones back together was only the first part of her recovery. The true recovery was being a whole person doctor to her and connecting her with a primary care doctor, checking to see what her bone density was, helping her understand the role of protein and nutrition in her life. Because yes, I am her bone doctor, but more importantly, I am her whole person doctor. You know, I'm not the kind of person that's had one mentor, but I've had the fortune of having different people in all areas of my life take enough interest in my career and my personal life to give me good advice. So the first person who gave me great advice was a retired surgeon, Dr. McGee, who was actually the medical director at Pfizer, who said to me, Vonda, capable doctors like you are going to be asked to do a lot of things, and you have to decide whether what you're being asked to do aligns with where you want to be 5 years or 10 years down the road. And that really helped me prioritize things in my career. You know, another great influence on my career was Dr. Freddie Fu, who is a giant in orthopedics, and he chose me out of the University of Chicago to come and be a resident in his program. And it was not only guidance for orthopedics, but truly opportunity and guidance for life. But there's many people like these two people. There's many women in my life who have come up beside me, risen beside me, and now continue to support me. Here, even in Lake Nona, we have a marvelous group of women executives who support each other every day. Each one of those people are amazing influences on my career and my personal life. Well, in the last 20 years of my career, a lot of things have changed. At the beginning of my career, we were still getting good at arthroscopy. Remember, I'm an orthopedic sports surgeon. So normally I don't make big incisions. We make tiny incisions through which we do a lot of work. Well, even arthroscopy has just been through a paradigm shift where now the surgery that we are developing using nanotechnology does not require incisions at all. It requires points of entry. This is an instrument that we do surgery with. In fact, I did surgery with this instrument this morning. It is arthroscopy vision on a wire. So isn't that tremendous? But what's most tremendous is not the technology. What's most tremendous is that we now do surgery without incisions, without the need for narcotics, in awake patients with very little recovery. It's better for patients and therefore it's better for us. The other thing that's amazing in the last 20 years is being able to truly harness orthobiologics and using a patient's own blood and own cells to heal them without surgery. I'm excited about the future, and these are only two of the reasons why. You know what? When I look back on my career, I have been incredibly fortunate. I've had great mentors. I've had amazing opportunities like serving at the University of Pittsburgh for 20 years and not only being the head team doc at the University of Pittsburgh football, but being able to build 185,000 square foot UPMC Lemieux Sports Complex and gather brilliant doctors together to provide whole person care. Or, for instance, when I went to Atlanta and built an orthopedic surgery department for Northside Hospital, and now in Orlando to build again for the Hughston Orthopaedic Clinic, and again gather great doctors together to provide amazing care. So that continues to be a goal of mine, is to serve the people that I serve in an elite way. But you know what my real life goal is? It's to raise a happy, healthy family, to raise my 6 children that I have with my husband, Peter Taglianetti, 5 of whom are adults. We have our first grandson, to be happy, capable, to serve other people, and just to continue to love each other in the way we have our entire lives. That's my goal at this point. Yes, I'm an orthopedic surgeon and I put metal in bones, and my practice helps people walk again. But the entire mantra of my career is that by saving mobility, I am going to save people from the ravages of chronic disease. So my research at the University of Pittsburgh was all about musculoskeletal aging and helping people understand that we are not destined to go from the vitality of youth down some terrible slope to frailty, after which maybe we break our hip and we die. No, we are not destined to that unless we choose to. I believe that we can be healthy, vital, active, joyful long into the foreseeable future by harnessing the power of mobility. Good thing I'm an orthopedic surgeon. By paying attention to smart nutrition and high protein diets, by lifting heavy things and building lean muscle mass, we can harness all those things. And that's my goal as an orthopedic surgeon, is to provide whole person care so that you not only live better from the time you get injured to the time we heal you and we say goodbye, but to live healthy, vital, active, joyful for the rest of your life. Anytime I talk about the Hughston Clinic, I remind people that we may be new to Orlando, but we are not new to orthopedics. In fact, Jack Hughston, our founder, founded the clinic almost 75 years ago. The story is that when orthopedic surgeons came home from the Second World War, they had learned how to salvage limbs. Instead of having to amputate them, they had learned how to save them. And with that knowledge, founders like Jack Hughston built orthopedics as a discipline from the ground up. And Jack Hughston just happened to do it in Columbus, Georgia. The orthopedic surgeons of the Hughston Clinic now spread across 4 states, from Georgia to Alabama to Tennessee, and now in Florida, in both an elective pillar of practice and a trauma pillar of practice. So when people ask me what is different about the Hughston Clinic than other groups, I get the privilege to say that we are a group that is based on a legacy of one of the founders of orthopedics in this country, and we are continuing to build from that foundation into the future. You know, the good thing about the Hughston Clinic is that we are 10 minutes from the Orlando airport. So, you know what is happening? People are traveling from all over the country to come here for our destination elite sports medicine practice. And I couldn't be more happy. So if I have ever seen you at a conference or in my practices in Pittsburgh or in Atlanta, or met you across the world like Marcel did in Germany and flew here to see me, you are welcome here. We are a destination practice and we would love to see you.